Okay, so hi everybody, I'm Devon. So now that Dr. Hare gave us kind of all the different indications that the EnerJet can do, I'm going to kind of dive into more of the publications, the case studies, all of the stuff that we have kind of proving that it works ultimately. And I'm really excited to talk to you all about this because I think out of our whole repertoire of technology, this is probably the most studied device that we have. So super excited to share this with you. And it's important too, right? We need to know that things work. Okay, so the first thing that we're going to dive into are histological samples. Now, for those of you who don't know what histological samples are, they are ultimately screenshots of the skin. They give us a picture of the skin on a cellular level. Now, one of the questions that I get asked whenever I go to an EnerJet training is, well, Devon, how do I know like what depth of penetration I'm really at? You tell me, oh, plug in 30% and here we go, but how do I really truly know? And it's based off of this evidence-based study right here. We could see that using pig skin and that ink, when we use a low pressure at 30%, we reach 4.6 millimeters in depth of penetration. Now, all the way on the opposite side of that spectrum, if we use a high pressure at 65%, you can see that we can go upwards of 7.7 millimeters in depth of penetration as well. I really love this diagram because the proof is in the pudding here. Now, piggybacking off of that, both Kara and Dr. Hare spoke on this, but we saw that after EnerJet treatments, there was definitely collagen synthesis in the skin on a cellular level here. And then there was also an increase of those glycosaminoglycans. Now, I won't go in depth too much on glycosaminoglycans because Kara touched upon those, but they really, really play an important role in the structure of the skin, right? They really kind of hold that elastin and collagen together. They draw water to themselves. And when they do that, they resist compression. The skin has a better bounce back. And then lastly, for those of you who are new to Sinclair, if anyone's new here today, we are like the kings and queens of talking about fibroblast stimulation. You will hear us talk about it over and over and over again. So I'm going to be talking about that right now. We have fibroblast stimulation here, and you can see after an EnerJet treatment, this is 4 months post, look at all of those fibroblasts in the area, all of that fibroblast activity. Fibroblasts are responsible for collagen and elastin synthesis. Okay. Now this is one of my favorite histological samples. I feel like I geek out like Jen Baker does too. But you can really see here in this sample of the skin that when that hyaluronic acid is dispersed into the skin, into nanoparticles, there really is no damage to the vessels, just like Dr. Hare was talking about. So it's huge that you see that, and I think it's really important to note, because this was my first question when we brought this on, was how do I know there's no risk of vascular occlusion? The proof is right here, and over 10 years of evidence-based practice and research show there will not be a vascular occlusion because we are diluting the hyaluronic acid to such an extent. Okay, so I'm going to piggyback off of the studies Dr. Hare was speaking about with you all, but the first study or case study I should say, that we have here is a kinetic facelift study. So this patient only had 2 treatments, and I think even without the measurements, you can really see the difference in the brows. I mean, look at that. This patient saw a 1.16 millimeter raise in her brows, a vertical height increase. Pretty significant. Now, on a larger scale here, there was a kinetic facelift study on 30 patients. And the results here showed that greater than 50% of these patients saw moderate improvements in aging. Now, it's important to note that with this study, a hyaluronic acid was used with glucose. Now, a hypertonic solution like glucose can actually irritate what's called the SMAS. The SMAS stands for superficial musculoaponeurotic system, and that's actually what's lifted up in face and neck lift surgery. So with the EnerJet, we actually have the ability to get to the SMAS. We can reach it. We can irritate it. When we irritate it, it contracts and it lifts the skin. So that's what we saw in this study here. Okay, let me just go through here. Okay, in this dermal thickening clinical publication here, this is a before and after. This patient had 3 EnerJet treatments, and they were 1 month apart from one another. So the results here, we saw visible improvement in wrinkles, skin laxity, moisture because of that increase in those glycosaminoglycans, and then also a reduction in hyperpigmentation, believe it or not. Now, on a larger scale here with dermal thickening, we studied 20 patients. They had 3 treatments with monthly intervals, and the treatment areas were the periorbital area, the forehead, around the neck, the nasolabial folds, the upper lip, and then also the necklines, those horizontal necklines. Aaliyah's actually going to be speaking with you all about that later, tech neck. So the skin thickness was assessed by ultrasonography here, and the main takeaway from this diagram or the study here is that at the 6-month mark is really when patients were experiencing the height of those benefits. The most dermal thickening was experienced then. So that's a realistic expectation to set for your patients. Okay. Ooh. Okay. So how many people have patients come in with those vertical upper lip lines by show of hands? It is so common, right? Everybody wants those gone, and they're very, very difficult to treat. I think right now people will use like very, very low G prime fillers to kind of chase those lines. They use fractional technology, anything to kind of just help build collagen to the area. So guess what? The EnerJet can actually help alleviate these lines as well. And we saw the improvement here with monthly treatments, 3 of them at the 6-month follow-up. A sonogram was performed, and there was a 20% average dermis increase. You can really see the difference in the lines here. Okay. Now, I truly believe that the EnerJet is going to become a gold standard for acne scar correction. Dr. Hare touched upon this, and I can't stress it enough. Right now out there, I mean, you can perform a subcision using either a cannula or a needle to kind of help break up the fibrous connective tissue that's kind of causing these depressions with acne, and it's really uncomfortable for your patients. But now that we have the EnerJet, we can quickly and pneumatically inject the material into the skin to perform what's comparable to a subcision. And that's why you're seeing such an improvement in this before and after photo here. That's exactly what's going on. So there were 10 patients in this study, and there were 3 treatments spaced monthly apart from one another, and you can really, really see the proof of how effective it is. 2 patients saw over a 75% improvement, 50 to 75%, or excuse me, 6 patients saw 50 to 75% improvement, and then an additional 2 patients saw 25 to 50% improvement. Okay. Now, this is a great publication as well. So unfortunately, this patient suffered from a case of shingles right on the forehead. And an EnerJet treatment was performed. And then after 6 months, the patient really, really noticed an improvement in the color and then also in the texture and how elevated the scar was. Okay. Now, Dr. Hare also touched upon the keloid scar study. This study actually had 21 patients in it. And they had multiple biweekly sessions, and then the follow-up was done at 3 months. The main takeaway here is that it really does work, and it is way more comfortable. I was just at a training yesterday, and there was a poor patient who had come in. It was actually a very, very significantly raised keloid scar, and she said, listen, I have been getting this injected for years. It's very difficult for them to even penetrate the tissue, and it hurts so bad. Like, she goes, I'm kind of dreading this. We did a treatment on her, and she told me that it was way, way, way more comfortable than having a needle injected into the skin. This is one of my favorite case studies that I've looked at so far because it's so life-changing. This patient experienced a burn that went all the way from the anterior arm down towards the axilla. Very, very significant. Unfortunately, what happens when you have such a large burn is when it scars, a contracture occurs. Contractures occur when the healthy skin kind of gets pulled in by that scar tissue, and then it affects your range of motion. It's really, really, really painful. So this patient here had 1 treatment using a non-cross-linked hyaluronic acid filler with a 30% pressure and an 80% filling. After that treatment was performed, this patient was able to obtain full range of motion back in her arm. That is so life-changing. That affects your activities of daily living. We're getting to the good stuff now. Okay. So, the EnerJet was also studied for the treatment of hyperhidrosis. How many people know what hyperhidrosis is? Okay, there's a lot of you. I myself suffer from it sometimes. Like right now, no. So hyperhidrosis is excessive sweating, right? And currently what you can do is you can hyperdilute Botox, and then you can make a bunch of little small injections to the axilla, to the palms of the hands, and to the soles of the feet. Well, guess what? The EnerJet was studied by doing this. We did this. It's awesome. Okay? So we had 11 patients in this study. One treatment was performed with 100 units of Botox, and the way that they did it was they diluted it with 7 mLs of saline. They split it evenly so that it was 50 units per side, per axilla, per palms of hands, per soles of feet. Now, I don't know if any of you are familiar with the way of measuring how much someone sweats, but it's something called a minor test, and that was what was used to kind of, objectify ultimately the result here. So using the minor test, if you guys take a look at picture A or figure A, you can see how much purple is present in the area. Now, what that means is that they put an iodine on the axilla, they let it dry, and then they put a topical cornstarch on the area after. What happens when we sweat is that it starts to turn purple. So look at how much purple is present in figures A, right? When you look at B, after that one treatment, look at the reduction in the sweat. Pretty significant. That could also be life-changing. Okay. And we saved the best for last, okay? So I am so excited that we got approval to share this with you all. So this is a study that was published or is going to be published overseas. And because you guys are all here at Beauty Boss today, you guys are all gonna get a sneak peek and you're the first ones to hear about it. There was a hair growth study performed overseas using a hyaluronic acid peptide complex. This study had 12 patients who were experiencing thinning of the hair, okay? What they did was they gave them 4 treatments spaced over 8 weeks. Every 2 weeks they would come in. After that time frame, what they noticed was not only was there an increase in density of the hair, but also the number of hair follicles. Now, for those of you who are familiar in research, we use something called a p-value in studies, and a p-value ultimately tells us how significant research is. It lets us know, is this clinically significant? Is it not? Like, kind of what's the deal here? So our value here, p-value, was a 0.05. Anything under a 0.05 is significant. We now can say, long story short, that the EnerJet works for hair restoration, and we are so excited. Yes! So with that being said, that's kind of the end of our clinical publications, but what we are going to do now is a live demonstration of the EnerJet.